Good morning, and thank you for joining us for this live conversation. It is officially flu season. We're also still seeing COVID cases in our region, and the common cold is certainly still around. So what do we need to know? And what can we do to protect ourselves and stay healthy this fall? To answer those questions, we've brought in Chief Infection Prevention Officer and Adult Infectious Disease Specialist, Dr. Marcy Dries, and Associate Infection Prevention Officer and Pediatric Infectious Disease Specialist, Dr. Stephen Epps. Thank you both so much for being here once again today.
Thank you.
So, the three of us have spoken at length over the last 3 years about COVID, and we talk about flu every year, but today is the official launch of our flu campaign here at Christiana Care, and the first day of vaccinating our caregivers in our caregiver campaign internally. So we'll start with the flu. Dr. Dries, what can we expect in terms of severity of flu this year?
Well, so what I always say is that the only thing predictable about flu is that it's unpredictable. And certainly COVID, I think, has thrown a lot of variability, even more variability into flu and other respiratory viruses as well. They're not behaving in their normal seasonality as they used to be. Flu has been pretty variable over the last couple of years. The first year of COVID, there was almost no flu. Last year, it was a moderate flu season, but it was really, really late in the season. This year, obviously, we don't know what's going to happen, but what we've seen from the Southern Hemisphere, which can often predict what happens in the Northern Hemisphere, is that, Australia, for example, had the worst flu season that they've had in 5 years. And also a very early flu season and more severe, and it affected kids a little bit more so than usual, though flu always affects the very young and very old more so than people in the middle. So I think, we're certainly, worried that this could be a severe flu season, and that's why, we really are encouraging, I know people have kind of gotten vaccine fatigue with all the COVID vaccines and boosters, but you really, really need to get your flu shot this year.
It's only the beginning of October, and we've already been seeing not a lot, but onesies and twosies of flu cases at Christiana Care during September.
So Dr. Epps, Dr. Dries mentioned those wide age ranges being, most at risk, the small kids, the older adults. Why is it that those age groups are most at risk for flu?
Well, the groups that we worry the most about, of course, are the elderly, greater than 65, especially with underlying medical conditions. I think a lot of people don't realize that kids, especially children under 2 years of age, are at risk for severe flu symptoms as well. And, between 40 and about 190 kids die every year from the flu. It's just something for people here watching Facebook Live to know about. And half of those are kids without underlying medical condition. And a lot of those, of course, would be vaccine preventable. But anybody with chronic medical conditions, and you pretty much name it, it'll be on the list. Pregnancy and then the extremes of age would be the risk factors to worry about.
And the other thing I would add is, certainly we can't vaccinate any child under the age of 6 months because the vaccines aren't licensed that low. But certainly the way to protect those babies is, of course, to get the mom vaccinated before they give birth. So some of those protective antibodies will pass over. And then also, once the baby's born, to vaccinate everyone around them, all the siblings, the grandparents, the nanny, both parents, kind of cocooning those babies in that layer of protection. But I think it is like Dr. Epps said, it is important. Like we've got used to COVID not affecting young children very severely in most cases. But flu is very different in that, young kids are at increased risk.
So Dr. Dries, let's talk a little bit more about the vaccine then. Some people are saying, I've gotten all of my COVID shots. They have to count for something, or I didn't get my flu shot last year and didn't get the flu. What is your message to those who maybe are hesitant about getting that flu shot this year?
Well, so, we have decades of experience with flu shots. They're very safe. We have a wide variety of types now. So even if you have a history of egg allergy, that's no longer a consideration. They're safe in pregnancy. They're safe, like I said, for everyone over 6 months of age is recommended to get it. But particularly those people that are at higher risk, pregnant women, very young, and the very old, but really everybody at this point, because even if you're yourself not high risk, you're probably in contact with people who are, and so it just helps protect everybody. And we know that they won't prevent every case of the flu. That's not what they're designed to do. They're designed to prevent those severe cases, severe disease, and deaths from flu, and they do very well in that regard.
And, it looks like, again, very unpredictable, as you said, but it looks like we are going to have a flu year and a COVID year this winter. And getting vaccinated against the flu actually has an additional benefit of, taking that out of the, letting people know that they're going to be less likely to have a febrile respiratory illness that could be confused with COVID.
Obviously the flu vaccine doesn't protect against COVID. The COVID vaccine doesn't protect against flu. But they both will work in synergy with each other. And there's also research that shows that, particularly for older people, you're at higher risk of having kind of unrelated things like heart attacks, like within the 6 weeks after getting the flu. So getting the flu vaccine, preventing those illnesses, prevent some of those other medical things that we wouldn't even think about being caused by the flu. But there is evidence that it protects against those as well.
And before we dive into COVID booster, flu shot, you can get it at the same time, correct?
Yes, you can.
Whatever works for people to, maximize the rates of immunization. You can get it at the same time. I got my bivalent COVID booster yesterday. I'm getting my flu shot tomorrow. Whatever works for people.
Yeah, you can get them one in each arm. You could even get them both in the same arm as long as they're at least, a little bit apart from each other, a couple inches apart. So it's really whatever you want to do.
So let's talk about that new booster that you can get at the same time as your flu shot. What is the scientific evidence behind that booster, and why has it adjusted, since those boosters first came out last year?
So the updated COVID booster is what they call a bivalent booster. So it has two strains. It has the original strain that emerged, back in 2020, which has been the component for every vaccine up until this point. And then it has what's called the BA4, BA5 spike protein strain, and that's what's currently circulating now. So the idea is exactly like every flu shot that we have every year, is that they put different strains of flu into the flu shot. They're putting two strains of COVID into the COVID vaccine. And the whole idea is that it raises antibody levels and protection against a broader variety of strains, including the Omicron strains that are circulating now. And the hope is, although only time will tell, is that it will provide a more durable or longer lasting protection as well. So we won't have to keep getting boosted every 4 or 5 months. That the hope, again, is that this will become an annual shot similar to the flu shot.
Doctor, I have to ask about side effects. You said you just got your booster. So many people are saying, I don't want to feel terrible. I'm not getting my booster. Talk about those potential side effects.
Well, I think most people know that you can get injection site reactions, meaning that your shoulder hurts a little bit for a day or so. And then there's usually some mild constitutional symptoms like feeling a little fatigued or weak, sometimes a low-grade fever. But many people tolerate it with no substantial side effects at all. And to add to what Dr. Dries was saying, the BA4 and BA5 components are very important because that's almost 100% of what's circulating in the United States right now. So it's a great way to protect yourself.
Yeah, and as far as the timing goes, the reason it was really, pushed through in September and is available now is so that we can get as many people vaccinated with that updated booster going into the winter, right? Because we know that as the weather gets colder, like today, people are going to be indoors more. All respiratory viruses, nearly all, thrive in that environment, and they just can be transmitted much more readily between people. So we want to get people as immune as possible kind of going into the winter season.
So I know both of you have kind of mentioned this, but let's really address that fact that, you're just because you're vaccinated doesn't mean you're absolutely 100% not going to get COVID or the flu, but it'll stop you from being hospitalized, from having severe cases. So touch on that a little bit.
That's exactly right, Megan. And that's a great point to make for your viewers. When the original Pfizer and Moderna vaccines rolled out in the end of 2019 and really started getting used a lot in the beginning of 2020, we were saying that the efficacy was about 95%, and that was what was shown in the clinical trials. So outstanding efficacy against preventing illness due to COVID. Well, as the virus has evolved and we've gotten the Delta and the Omicron and the subvariants, it's not quite as good. These original vaccines are not quite as good at preventing illnesses, but they're still very, very effective at preventing severe illnesses, hospitalizations, and deaths. And I think for flu, a lot of people know that flu vaccines are not 100%, and it's in the lay media, it's on news reports. It's often between 40 and 60% efficacious in a given year. But rather than quoting a percentage, I think it's important to say, what is the impact? So the one I like to, the numbers I like to quote are from the last flu season before the pandemic hit. Flu vaccines prevented 4.4 million illnesses, which is greater than the population of Los Angeles, prevented 58,000 hospitalizations, which is about the number of attendees at Ohio State University, and prevented 3,500 deaths. So impact is terrific.
So according to the CDC map, Newcastle County is showing low community spread. It's finally in the green. Kent and Sussex County still in that yellow medium community level. What should people understand about that current state of COVID and what that map really means?
So the community levels that the CDC puts out are really based on two things. It's number of new cases that are being reported, with the knowledge that they're widely underreported, right? Because so many people are doing home tests now that they're testing positive at home. They're never reporting that to any sort of database. They're not going to get retested at a laboratory that does report. So we know that is lower than what's actually happening. But then they also look at hospital capacity, like new hospital admissions, et cetera. So it's really intended to increase, as that level goes up, people should start to be more careful to prevent, really overwhelming the hospitals, like what happened last year in December, January, where we at Christiana were in crisis standards of care. It was bad everywhere. So I think people have to take it a little bit with a grain of salt, right? Because we know that it's going to be underreported. And I think at every level, whether it's low, medium, or high, people need to do everything that they can personally. So whether that's obviously getting up to date on all the vaccines for COVID. And actually knowing what your personal health risk is, or what the risk of those around you is. So if you're a high risk person, like you're immunocompromised, you might want to continue to mask when you're out in public. Absolutely, because that we don't want to put all our eggs in one basket and say, okay, I got vaccinated. As good as the vaccine is, like we have to do other things too. And again, keeping kind of that situational awareness around where things are going in the community can help guide you. And some people will choose to mask everywhere they go. Some people will mask as the levels start to go up. And just be careful around kind of who you're around, and because again, in public, you don't know what other people's vaccination status or symptoms or any of that is. So you can't throw all the masks away. Like that's still a really important part.
Absolutely. And will masks also help prevent the flu, your common cold, RSV, et cetera, et cetera?
Absolutely.
Well, most viruses are transmitted in droplets, right? So when people cough, sneeze, et cetera. And we know that the standard masks that a lot of us have been wearing for 2.5 years are pretty good at preventing you from inhaling droplets that contain viruses. So, yeah, and as Dr. Dries mentioned, a lot of the epidemiology of our viral infections like flu and RSV have been topsy-turvy during COVID. And a lot of that is due to the fact that people are wearing masks and of course distancing and washing their hands, et cetera. But masks will prevent other infections besides COVID.
And right before we went on, we talked a little bit about the next couple of months going into the winter. Obviously you don't have the answers. No one has the answers, but do you see us kind of putting those masks on a little bit more as we go into the colder months?
Yeah, I mean, I think we all are, anticipating our COVID numbers going up. So right now, I mean, we certainly are seeing people in the hospital now with COVID, and we've been at kind of a steady state for the last month and a half. But the last 2 seasons have shown us that numbers start to rise as we get into the colder months, and have peaked in around December, January. Last year, of course, we had the additional emergence of Omicron, which a lot of people didn't have immunity to, either from past infection or from vaccination. So that kind of added onto it, and that could happen again. Certainly, another new variant could come out of left field. That's something that we really can't predict. But even if that doesn't happen, I think, we are anticipating, again, just for the reasons I said before, people are indoors, they're closer proximity. We would anticipate the COVID numbers going up, and that probably the levels in the community will rise, and masking is going to be recommended again. I don't think we'll get to the point where we shut society down. I don't think anyone wants to go back there, but I think masking is a simple and effective thing that we can do to reduce transmission.
And would you recommend, even if you just aren't feeling great, you wear a mask if you're going to Target, Acme, places where you could be in contact with others?
Absolutely, because that's what we call source control. So masks work to prevent you from spreading to others, and they prevent you from catching things from other people. So we talk a lot about presenteeism, which is the opposite of absenteeism, when people go to work despite the fact that they're sick. And that can be, because of the flu, because of COVID, because of a GI illness. Like, there's lots of reasons people can feel like they have to go to work, and sometimes it's because they don't have paid time off, but sometimes it's just a choice that they don't want to let down their coworkers. I think for the most part, people are noble about it, but what you don't want to do is then bring it to work and spread it to all your coworkers. So I think it's okay to take sick days and not come to work when you're feeling, if any sort of febrile illness, certainly any illness where you're throwing up or having diarrhea. COVID can be tricky because some people have really mild symptoms and some people have more severe symptoms. So I think that's a little, you can't call out at work every time you have a sniffle, but then that's a way that that's a time when you could, choose to mask, distance yourself at work as much as you're able to, and prevent spread that way until you kind of can figure out what it is.
So speaking of figuring out what it is you have, how does someone know? So, if you wake up and you have a sore throat, you have a little bit of sinus congestion, your immediate thought, I think these days is, oh my goodness, I probably have COVID, but it may not be COVID. And how, especially now, is it the flu? Is it, you're ticking off in your head all of your symptoms, trying to figure out what it could be. Do you have any tips for someone in that situation?
I think more and more people are using home testing, the antigen testing for COVID, and that's fine. And I think that's what's on top of people's minds is, do I have COVID, like you said? So, the home tests are not perfect, but they're pretty good, depending on the timing of when you do the test in terms of when you're having symptoms. But yeah, you can do the COVID test and then just take care of yourself with symptomatic relief, etc. When should people become concerned, and when should they perhaps be calling their physician? Well, if their symptoms are unusual or severe, if they go on beyond 10 days, because sometimes that's when a viral respiratory illness evolves into a bacterial sinus infection. Certainly children under 3 months of age, you'd worry about any fever, you should report to a physician or some other provider. And remember, folks, that when you if you have to go into a doctor's office, that's definitely a time you want to take your mask and, do all the responsible things.
Yeah, the other thing I would add is, typically when we think about the flu versus a cold, like the flu kind of comes on like that. You go from feeling like fine in the morning to feeling like you've been run over by a truck in the afternoon, and just, headache, body aches, just feeling lousy. Whereas the common cold tends to come on more gradually over a couple of days. COVID could do any of the above, right? So it's really variable. So you really can't tell based on symptoms alone. You can do home testing for COVID, like Dr. Epp said, but you can also call your doctor and find out if you can get a test. We have combined tests for flu, COVID, and RSV, respiratory syncytial virus, that are available as an outpatient or inpatient. And because some of these treatments are time sensitive, right? So we probably underutilize the treatments for COVID, but there's also treatment for flu. But really, they work best when they're started early, like within 5 days of onset of symptoms for COVID. They won't even treat you if it's been more than that. And then within 2 days of onset for flu. So, you can always, so you always want to, try to, if you feel pretty bad and if you're high risk, like if you're pregnant or if you're older and have other medical conditions, you want to probably try to get tested sooner than later so that you can start one of those treatments if appropriate.
And I completely agree with that. But, if somebody is at risk for complications from the flu and they have classic flu symptoms in flu season, they don't always require testing. And, the medications like oseltamivir or Tamiflu can be prescribed by a physician just empirically.
Yeah. at this time in the season where we're not yet seeing a lot of flu, we do like to have people tested just so we kind of know what we're dealing with, and we can start to see which strains of flu are circulating. But certainly once the flu season is well established, that's exactly right. You don't have to be tested to get treated for flu.
So Dr. Epps, Dr. Dries, thank you both so much for sharing this information. Before we go, what is the most important thing each of you want our viewers to understand about this flu season?
Really just that, we know it's coming. Now is the perfect time to start to get vaccinated, and don't delay. We want, we're worried about an early flu season. And so you don't want to kind of wait and see. You just want to go ahead and go get your flu shot.
Yeah, I totally agree with that. And just be safe. Do the things that we've known for the last 2.5 years are effective, and pay attention to advice from public health authorities.
Well, thank you both so much. And if you are watching and have more questions for Dr. Dries and Dr. Epps, please put those in the comments. We can chat with you after this live wraps. And as always, christianacare.org has resources for flu, COVID, and anything else that you may need. Thank you all so much and have a great day.